Mirrors on Clicks Live, revitalizing radio. If you sometimes pass a mirror or look into it, and sometimes you smile into it, and you notice some irregularities in your teeth, for example, maybe they're not as white as you want them to be. Maybe you're not as proud of your smile as you want it to be. This then leads me to the next guest that I have on the line. Last year, the FDI, World Dental Federation, launched their 3-year campaign theme, Be Proud of Your Mouth. Be proud of your mouth is not about having a perfect mouth. It is also about having a healthy one. The World Dental Federation would like people to value and take care of their oral health and to make the correct decisions in order to protect oral cavity. The good oral status will require a lot of action. Be proud of your mouth by doing this. For example, be proud of your mouth by visiting the dentist regularly. Be proud of your mouth by brushing your teeth twice a day. Be proud of your mouth by cutting down on sugary treats. To inspire action, we need to explain why. And this is where the campaign strapline fits in. In 2021, the World Dental Federation encouraged the public to take action by focusing on the importance of oral health in order to enhance overall health. Now in 2022, they are reiterating this message by highlighting the fact that an unhealthy mouth can severely impact every aspect of your life. That is why they are calling upon everyone to look after their oral health for their happiness and well-being. Today's oral health interview is proudly brought to you by the South African Dental Association, known as SADA, in association with the Oral Hygienists Association of South Africa. SADA's vision is to be recognized as the trusted leader and voice of oral healthcare in Southern Africa. Their mission is to promote the interests and serve the needs of their members, and above all, to encourage optimal oral healthcare for all South Africans. Learn more about the South African Dental Association by visiting sada.co.za. Now, joining me on the line is Gilbert, and I feel like I played that Mirrors song just in time, because you know what, Cole, we actually do want to look in the mirror. We do want to smile, and we do want to be proud of our smile and proud of our mouth. Am I not right?
That's absolutely right, Robin. Thanks so much for having me on the show with me today.
It's awesome to have you. Welcome to Clicks. Would you like to just tell us just a little bit about yourself before we continue?
Sure. So, as mentioned, I'm called Gilbert. I'm a registered and qualified dental hygienist, and I qualified at the University of the Western Cape a few years ago. Won't say which year. I currently work as a dental hygienist in private practice at an aesthetics practice in Newlands. And then I'm also back at the university lecturing undergraduate students as a clinical teacher and junior lecturer. And in addition to that, I work closely with SADA and OHASA as I'm the president-elect for OHASA in the national branch. Yeah, that's just a snippet about me.
Awesome stuff indeed. You are definitely more than qualified to chat to us about what we will be talking about today, which is what I would really love to chat to you about, and that is professional teeth whitening and bleaching. Now, first and foremost, can you actually tell us what causes yellow teeth?
Yes, I think the cause of yellow teeth, firstly, is it's very multifaceted. There's lots of contributing factors to this. So let's break it up. And I think the first part is the thinning of enamel. So we generally see the older people get, the more yellow their teeth appear. And that's because the thinning of the outside layer of our tooth, which is called enamel. And under our enamel, we've got a layer that's called the dentine. And this dentine, naturally, its color is a deep yellow to brownish material. And that's often responsible for what we see. So if the outer, in the whiter layer, the enamel is thinning, we then see this yellowy appearance shine through. Now, thick enamel obviously covers up that dentine, but we need to keep in mind, like, our daily and environmental habits also affects yellow teeth. Things like nicotine and smoking It's a big contributing factor to yellow teeth and staining. And then, like our diet, so things like curries, red wines, coffees, teas, all of those things contribute to our teeth appearing more yellow. Yeah.
All right. I was actually going to ask if drinking wine and smoking also contributes to that. So thank you very much for adding those details. So how does professional teeth whitening then actually work?
So professional teeth whitening, firstly we need to understand that it's a chemical process that takes place, and a solution of hydrogen peroxide is used, or carbamide peroxide is used on the teeth. And it's important to know that when we do a whitening procedure, we're not just painting on something on the teeth to make it look whiter. This hydrogen peroxide or carbamide peroxide actually penetrates the enamel and whitens that yellowy underlying material called dentine. So by whitening that layer, our teeth then appear whiter.
All right, so you have spoken about peroxide, you've spoken about penetrating the layers. Is teeth whitening actually safe for my teeth?
Yes, so this is a question that we get often, and teeth whitening or professional teeth whitening is definitely effective if done by a health professional, or by a dental health professional. We will not advocate or promote a product on a level like OHASA if we know that it's not safe for you. So there's lots of research out there and studies that shows that teeth whitening and bleaching is definitely a safe procedure to do, and so much so that there's lots of advantages for the person doing it. Besides just whitening teeth, it comes with things like confidence boosters, all of the other things that comes with having a healthy whiter smile.
Exactly. I feel like if your teeth are sparkling white, you tend to smile a lot more as well. You want to show them off. And when you have those stains, I notice that sometimes if somebody has stains on their teeth, they can actually feel it, and I feel like they start to speak kind of closed mouth, kind of just shy to really open up their mouth or really just laugh. They don't really want to laugh with their mouth open or anything like that, because they're scared of people actually seeing those stains, you know? I don't know if you find that in your own life as well.
That's very, very true. And we actually have research that shows that people with healthier teeth and a brighter, whiter smile have greater job acceptance. So they're better accepted when they go for things like interviews and just in their social setting, because of the fact that they are proud of their teeth and their teeth are healthy or their mouth is healthy. They smile more, like you mentioned. So there's definitely factors to having, or external factors that can help us in our day-to-day life with having a healthy and whiter smile.
Exactly. I completely agree with you on that. Now, who is allowed to actually do professional teeth whitening?
Great. So teeth whitening or professional teeth whitening it forms part of dentistry. So dentists are allowed to do professional teeth whitening, dental hygienists are allowed to do professional teeth whitening, and then also dental therapists. Now, within South Africa and within the world, we have salons offering teeth whitening. Within our country, that is illegal for them to offer teeth whitening. And I think more so it's just putting your own oral health at risk, and that's what we don't want. So if it's being done professionally, you know that someone studied to do it. They know the anatomy of the teeth. They know what can go wrong and how to manage that. And that's why we say that professional teeth whitening should only be done by a dental hygienist, dentist, or dental therapist.
And how effective is the professional teeth whitening?
So, like we spoke about earlier, a whiter, brighter smile is obviously a confidence booster first. So it has that effectiveness to it. And then professionally applied whitening can lift your color up to 8 shades, depending on the product used and depending on the intensity of the product used. So there is a big difference between where we start off and where we are going with teeth whitening. Remember, each person's tooth is different, so it depends on the makeup of the tooth and external factors that play into that. But generally, we can safely say that we get a shade lift of about 8 shades, which is quite dramatic with a professional in-chair whitening
All right.
procedure.
So, Cole, I just wanted to ask you. You spoke about the professional teeth whitening and being able to lift it up to 8 shades whiter. Is that right away, or is that sort of like a process that you go through to get it to that 8 shades whiter?
Yeah, so a good dental hygienist with or practicing good whitening procedures will always say that it will never be on the first visit that you'll see that whitening. Whitening is a process, and for each person it's different. So if you come into my chair, I have a look at your teeth, we discuss, we look at things like budget and where you want to end up at, and then we kind of work out a program for you. So it can take anything from 1 week to achieve, or it can be a bit longer, from 3 weeks to achieve. It all depends on what we are trying to achieve and how we're going to get there. So are we going to do full in-chair? Are we going to do some home whitening as a maintenance, which is always advised? So it differs. It's generally not just in one setting.
All right. So, how often can you actually go for teeth whitening?
So professional in-chair teeth whitening you can have done every 6 months to a year, because the results or how long it lasts is about 6 months to 2 years. But that again depends on your external factors like your coffee intakes, your
Of
smoking,
course.
your red wines and things like that. So for me personally, I've had an in-chair whitening done about 5 years ago.
Mhm.
And I have a maintenance kit that I just maintain with at home. So every 3 months, I have a maintenance kit that I pop into my mouth for 15 minutes, and that's to maintain my white teeth.
All right. So you spoke about the peroxide and penetrating the layers of the enamel. It sounds pretty painful to me. Is it painful?
Yeah, so with whitening, you can expect a bit of sensitivity.
All right.
It can be
Sensitivity.
prevented, however, if it's
Mm-hmm.
done by a dental professional, or it can be managed. So if you come into the chair and you say, I generally have sensitive teeth, as a oral hygienist, I'll know we are not going to do maximum work in one setting for this patient because they're already experiencing sensitive teeth. And then we will manage it by breaking up your sessions. So instead of doing 4 sessions on one day, we'll do 2 this week and 2 in about 2 weeks' time. And that's how we manage the sensitivity and the pain. But generally with the whitening procedure, there can be some sensitivity, but it should not be intense sensitivity that you can't sleep at night type of thing. If there is sensitivity after whitening, it should generally go away within the first few hours afterwards.
All right. So it's not necessarily painful. It's more like your tooth is just your teeth are just gonna be kind of sensitive after
That's it. Yeah. So
afterwards.
you basically feel like a sharp shooting pain, and those pains generally last for like 1 to 3 seconds, and then they disappear for a bit, and then you'll feel it again. And that's basically the duration of it. But it can be prevented, and it can also be managed.
All right, so if you have just joined us inside of a Clicks store right now, we are chatting to Cole Gilbert, and we are talking about professional teeth whitening and bleaching as well. So for anyone who has missed it, how long does professional teeth whitening actually last?
Yeah, so like mentioned, it can last anything from 6 months to
Mm-hmm.
2 years, or even longer. But it depends on the maintenance regime that was being offered to you and your lifestyle habits. Things like smoking, red wines, all of those things stain your teeth faster. So if you do smoke or drink red wine, you know that your interval of your whitening lasting might not be that long.
So there you go. That is how long it lasts. If you have just joined us and you missed out on what Cole had to say just a little bit earlier on. You know what? I didn't actually ask you, what is the process actually? Because I'm seeing a lot of pictures with like molds with solution in it, with like UV lights and all sorts of things. So can you explain how the process actually works and the
Sure.
method?
Yeah, no problem. So I prefer a brand called Philips Zoom for in-chair professional whitening, and that process can differ from other manufacturers. So if you step into our chair, we'll definitely do a custom-made mold of your teeth. So we'll take an impression of your teeth so that you can get a maintenance tray once the whitening is done. So first step is we first make sure that the teeth and the gums are healthy and clean. So you'll come in for your general dental cleaning first, and then we'll do an impression of your teeth. That impression then gets casted, and we make a little bleaching tray for you from that. Then bleaching is done. Our bleaching is done with a light. So we first block out the teeth, put a retractor in your mouth to make sure that the bleach or the solution doesn't get onto your gum anywhere. And then we put a light onto your mouth, and that's generally 4 15-minute sessions, and that's what we can break up in 1 week, 2 weeks, or 3 weeks, depending on your sensitivity and depending on how many shades you want to get lighter. And then once that whitening is done, the in-chair whitening is done, we then send you home with those custom-made trays, so it only fits you. There's less chance of the solution when you're putting it into the tray at home than going onto your gum and causing a acid burn on your gum. So that's generally the process with the teeth whitening.
So you send us home with the impression of our mouth, the tray.
Yeah, so exactly. So you'll get a tray, a bleaching tray. We call it a bleaching tray, and you'll get some solution. So the process of whitening, if you do an in-chair whitening, we're lifting your shade dramatically, and now we need to maintain that, otherwise it's going to be a fast drop. And to maintain that, we send you home with a bleaching tray with whitening solution, and we ask you to whiten for about a week or two at home, just to take that shade up even more, but also to take it up more gradually and not that sharp spike that we've done in the chair.
All right. Okay, cool. I was going to ask you about how to maintain these beautiful results at home. But let me go on to my next question. At what age can professional teeth whitening start taking place?
Great. So professional teeth whitening is generally only advised for people who are older than, say, 17, 18 years of age. But there are a few factors that come into play when we look at age. And therefore, it's always good to visit a dental professional that will do a whitening assessment on you, and just to make sure if you are the ideal candidate for whitening. Most people are not, or there are people that are not ideal candidates for whitening. So if you've had a filling done on your front tooth, for example, if we whiten your teeth, that filling material will not whiten, which means you have to have that filling redone afterwards. It's because the dentist that did the filling would have matched the color perfectly to the tooth color at the time. But if we're now whitening the teeth, that filling area will then not be as white as the new whiter teeth.
All right. And then, Cole, I do actually want to ask you, do over-the-counter teeth whitening products really work?
Okay. So once again, this is a bit of a sticky subject, but any product that does not contain hydrogen peroxide or carbon peroxide won't scientifically whiten your teeth, okay? Most over-the-counter products and rinses have stain removal properties, and that's great for removing things like smoking stains and wine stains and stains that have accumulated on your teeth due to your habits, basically, your lifestyle habits. But they won't change the color dramatically of your teeth. So your teeth will appear whiter because the stains are being removed, but they won't lift shades. We should also be very careful because some of these over-the-counter products can be very abrasive in nature, and you could be causing some damage to your enamel. If you feel that a toothpaste or a whitening paste is very gritty or sandpaper-like, it means that it's very abrasive, and that could cause micro scratches on your enamel. So we try and steer away from pastes like that.
All right. So we can indeed use the products, but more for stain removal and to prevent stains as well.
That's right, yeah. So we generally advise people to use a whitening product, like a toothpaste and a rinse, post-whitening. And we advise, obviously, a good product that they can use, but it won't necessarily lift shades, but it's perfect for someone who just wants to maintain their natural color of their teeth and don't want it to get any darker by things like smoking and red wine and things like that. Yeah, but it's perfect and brilliant and perfectly safe to use for stain removal.
Oh, okay. Actually, that is just such good news indeed. So if any of our listeners would just love to get hold of you, how can we actually do that?
Sure. So firstly, if you want to get hold of the association, we look at the Oral Hygienist Association of South Africa's website, which is www.ohasa.co.za. And then personally, I'll share my business number. It's
Of course you can.
076-561-4258, and that's Cole Gilbert.
Thank you so much, Cole Gilbert, for that.
Great.
Just amazing. I feel like it's so important to chat about teeth whitening because, like we mentioned earlier on, it's all about that confidence, being able to smile and being able to just go out there confidently, even in interviews, talk boldly to each other and just sell ourselves. And the thing that we do right now is we wear this mask most of the time, which is kind of okay for us. If we have those stains, but we have to remove them at some point, and we have to let people hear our voices, and then we kind of just shy away from chatting because we have these stains, we have these gaps, we have these cavities, and it's just so important to chat to professionals like you to just give us information on how we can actually smile more brightly and more proudly. So thank you so much for that. So I actually wanted to ask you, I'm sure that the prices range with regards to this depending on clients. So how much can we expect to pay kind of roundabout for professional teeth whitening?
So, like we said, we look at customizing whitening. So whitening is not a one-size-fits-all procedure. We obviously customize it. So we can look or price range anything from 2,500 Rand, and it can go way up to like 7,500 Rand for professional in-chair tooth whitening and take-home whitening. So that's generally the price range that we're looking at. And
of course, it also depends on the severity of the situation, right?
That's
as well.
Right. Yeah.
Of course.
Yeah.
Thank
so
you.
There are lots of factors to take into account. It's definitely an investment in yourself, and we see that often people have almost invested this time and money in their self and in their smile. Remember, whitening only happens on healthy teeth and clean gums. So it's paramount to always check your hygienist 6 monthly, and they will then advise on whitening procedures for you.
Of course. Thank you so much. It's been so amazing to chat to you. Thank you so much for your time today.
No problem. Thanks so much for having me, Robin. It was lovely chatting to you too.
Absolutely. You definitely make me smile.
Yeah, please pop on by. We'll sort you out.
Oh, you need to, because I need to get whitening done myself. This is something that I've been wanting to do for myself for quite some time, and I've been seeing these things on the social media and stuff, and I'm not really comfortable with going to any person with this. And it's so true what you said. You need to go to a professional, to somebody who knows what's going on in your mouth as well. And I definitely think this whole week we've been chatting to different dentists and hygienists as well, and I feel like I'm taking home quite a few of the tips for myself. Like now I brush my teeth longer. I actually brushed my teeth longer this morning as well. I'm chatting to Cole today. He's not going to be in studio, but I'm just going to brush it like extra. I don't know why. And one of your colleagues, I think, told us about like licking our hand as well. And then smiling it. We were talking about halitosis. And then she was like, you know what, that could be a test just to make sure that your breath is like 100%. And on air, I was literally like licking my hand and smiling it. I'm like, okay, cool. We're still good. It's great that we can pass all this knowledge on to you and to your listeners. And I think as part of this whole program of World Oral Health Day, that's what we want to do. We want to bring awareness